the most fundamental misconception about the cloud is that it is less secure than an on-premise infrastructure. So there's a significant problem with a myth of that nature, and it really is a myth. The cloud is as secure or as less secure as any other infrastructure. And if implemented correctly, it can actually be more secure and can provide greater privacy than an on-premise infrastructure. Let me give you an example. The cloud emphasizes two specific things. It emphasizes that you must encrypt the data in transit, and you must encrypt the data when it's at rest. The ability to encrypt data in transit exists today, and the ability to encrypt data at rest exists today. So if you take those two very simple premises and you translate that to a cloud infrastructure where they're implemented correctly, you can actually create something which is a lot more robust and secure than, let's say, an on-premise infrastructure where you do have the ability for people to break into physically your data infrastructure, your data center, and or have data on laptops which are unencrypted and which are being used in a fairly loose fashion in a healthcare organization, and that creates security risks that don't exist in the cloud, because the cloud infrastructure, quite frankly, is not reachable by human beings through physical means. You can only get to them by authenticated and authorized means, which gives it an additional layer of security. The other important part about the cloud infrastructure, which also applies to on-premise infrastructures, is an approach called defense in depth. Defense in depth really means that you create multiple layers of security that allow you to have a fortress-like infrastructure around your data that keep it secure, that keep it private. And again, those are best practices that are starting to emerge in the industry around defense in depth approaches. A great example is to have multiple different types of technologies play a role in creating the defense in depth. So I talked about encryption of data in transit. I talked about encryption of data on disk. There's also the issue of being able to find intruders, so an intruder detection system, an intruder alert mechanism, and abnormal usage infrastructure, as well as management of encryption keys, role-based access control. There are a number of technical terms and technical approaches that can be used in creating a defense in-depth approach, and that creates, in my mind, a robust cloud infrastructure which is secure and private and can meet current and future upcoming HIPAA needs. So data-driven healthcare and care coordination are very big terms, and they are hard to define. So what we're going to do instead is we'll take an example of what care coordination means, and then we'll talk about how data can actually help coordinate care in that example. So care coordination essentially can be broken down into many parts, but specifically let's focus on care transitions of a sick patient. A sick patient may go from a primary care physician to and be referred to a specialist. From the specialist, there can be a hospital admission. At the hospital, there are multiple departments that are involved, including labs and the dietary controls and what have you, including care, of course. There might be procedures that are performed on the patient, and then there is a post-admission or post-procedure care in the hospital, which then translates into a discharge from the hospital, followed by a number of follow-ups with the specialist and with the primary, and perhaps even certain care guidelines that have to be followed at home. So care transitions and the care coordination umbrella term is a very, very complex set of interactions that happen. One of the problems in today's healthcare processes is that all of these transitions of care are aided by manual processes. So To give you an example, if a patient is at a hospital and has certain complicating conditions, they may be at risk of deep vein thrombosis in a very specific care scenario. Today, the way to identify whether a patient is at risk for deep vein thrombosis in that very specific scenario is by a clinician to go through a fairly large checklist and then apply judgment to see if this patient is indeed at risk. And DVT, as you know, is a very serious condition. It can result in readmissions or in certain cases death. So we want to eliminate this, but the way to eliminate it is to make sure that the clinician has a lot of data about the patient, the past medical history, the complicating conditions, the future prognosis. The problem is that this data is not available to the person or the clinician that is actually running through the checklist and identifying the patients that are at risk. This is obviously problematic. Data-driven healthcare promises to change this. Data-driven healthcare that uses both structured and unstructured data is able to create a feature map of a patient, and in other words, a picture of a patient which is complete in terms of the past medical history, in terms of the future, the treatment plan, as well as certain complicating factors that may exist due to a variety of information that's available on the patient's record. The ability to deliver this information, and when I say information, I don't mean data. I mean specific intelligence extracted from the patient record and delivered to the clinician that is going to be making these decisions. In this specific use case, the DVT identification is going to be critical. And we believe this is one of the big promises of data-driven healthcare.